everyone, I'm Tanya Kupchandani Vatsa. I'm the founder and CEO of Elixir Wellness, and I'm here today for a fun episode of Spilling Facts with our star dermatologist from Elixir Wellness, Dr. Sakshi Sitaniya. I'm going to turn it over to her and have her introduce herself and tell you a little bit more about herself and her background.
Hi everyone, I am Dr. Sakshi Sitaniya. I am a qualified MD dermatologist and I'm with Tanya for I think 1.5 years. And it's been an amazing journey. I want to begin with saying that being with Elixir, it's been home, it's family, and it's amazing knowing you as well.
Likewise, we can't imagine our day, the days that she's not here, the 2 days a week, which is all we've left her with at this point. We, I think, harass you the entire day.
No, but even, I think when I'm not here and I'm constantly checking my phone that someone's called, something's missing. So yeah, Elixir's been touchwood great so far. Happy to be a part of this.
Likewise. So Dr. Sakshi, what is the most common question we get from clients?
To be very candid, I'll say about IV therapy. But at Elixir, I've noticed that anyone who walks in, everyone nowadays are looking for a quick fix. Yeah. Everyone wants instantly, they want like, okay, we want a treatment that solves all our problems instantly. And like I've always told them, and I want to say it once more, that skin has been an investment physically, mentally, financially. There is no quick fix. And I think here at Elixir, we all focus on a holistic approach. So the quick fix mentality is what I feel is not the correct.
I feel that something starts from the minute the client walks in. Like we give forms and they're like, Can this be filled inside? Do we have to fill it?
Yeah, we have a huge questionnaire. If you've come to Elixir, you would know that we have a huge questionnaire. But it actually helps the clients to know what all services we have. Plus, it also helps us to understand before I meet them. It helps me to get their medical history or what is their interest or what treatment are they looking for.
And we try to keep it holistic. So we know their sleep, we know their lifestyle, their workout, so that everything can be addressed together.
Definitely.
So my next question to you actually is acne. What do we have at Elixir for acne? This is something I know that comes up from all ages.
Yeah. So acne is tip of an iceberg. I mean, I would like to speak for both of us. Tanya and me have had a huge history with hormonal issues ourselves. And acne is literally, people feel that, okay, let's come in, do a peel and you're done. But first, please, acne needs to be started with the root cause. That's why we have qualified doctors here who meet you, who understand your history and who take care of that. Coming to the treatment part, after taking care of the underlying causes, we have almost all treatment options available, from a medifacial to a chemical peel to laser therapy. I would like to specify on the damage that acne does. That's mainly your pigmentation and acne scars, apart from, of course, mental damage. But acne scars and pigmentation, we have laser options, we have depigmenting peels available, and all microneedlings possible. We have everything available here at Elixir, under, of course, expert opinion and guidance.
So a lot of the Elixir content, if not all, talks about customized medifacials and customized care. How do you at Elixir customize the care for the clients?
So medifacials nowadays, I mean, see, every skin type is different. What works for you might not work for me, might not work for someone else. So when we talk about customized, it's basically that we doctors meet the patient. We understand what is important is also patient's expectation and what results they are looking for. For us, we understand their skin and what they are looking for. Then we tell them, okay, you have these options available with us at Elixir and what they can expect after the treatment. Because I've seen a lot of patients come back with, okay, we did a cleanup or an exfoliating medifacial and they've got breakouts, they've got rash. I'm assuming till now it's been bare minimum. Touchwood, we've not seen any reaction because we focus on their skin and health more than just, doing a facial. So I feel that is one.
So speaking of skin and health, I have a popular question for you.
Yes.
Is glutathione for skin whitening?
Okay, I think you should only start with this because I'm tired of answering this. People have actually walked in saying, okay, you know what, I want to become white. This obsession of white is, I have not understood. I feel like in American society, brown skin is appreciated much more. But glutathione, Tanya, is such a beautiful molecule. It's not just helping at your skin level. It is something that is present in our body. It helps with your liver detox. It helps with your body detox. Indirectly, it's helping with your skin and hair detox. And if you're suffering with stubborn pigmentation, or you're suffering with a lot more toxins in your body, gluta helps with your muscle recovery. Post alcohol, we've seen people really damage their liver. In fact, there are doctors who give glutathione for liver damage, alcoholic fatty liver. So it's not for skin whitening. If it's helping someone get a brighter skin, that is probably the skin they are born with. You can never change the color that you're born with. So I would like to specify again that please don't consider gluta as a whitening agent. It's marketed in that way by a lot of people. It's not a whitening agent. You can also
absolutely
help us on this.
It's an absolute myth that glutathione is for skin whitening. It's a very powerful antioxidant. It's something our body makes that declines as we age. Correct me if I'm wrong.
No, you're absolutely on point.
But skin whitening, for the people that it does happen, is a side effect from their pigmentation getting less, their skin getting brighter. But it's not something that we at Elixir promise or even endorse, because we're all about loving the skin that you're in and what you're born with, and we're happy to help you get brighter, healthier skin that makes you feel more confident. It's not about skin whitening.
100%, absolutely.
So my next question to you is collagen mask. You recently did a myth-busting video that I know I have shared multiple times. Every time I see this collagen mask video on Instagram, there have been so many videos and so much content right now about collagen masks or collagen mask sheets that dissolve into your skin. What are they, and do they actually work?
I think here we should also share that video that it's actually both our ideas combined together that we did that video. And I have tried it myself, and I tried it a week back before that video, and I still have that redness and bumps. I don't know if it's visible right now, but these collagen sheet masks, I've said it in the video, I'm going to say it again. They are basically mask in form of sheet, which when you apply, because your body's temperature is on the hotter side, it gets dissolved. People feel that it's helping you with building your skin collagen. It's not. It's just giving you a plumping, hydrating effect, which is very temporary. And as a dermatologist, I'll say don't try it, but I feel for Elixir, you should also try and give your opinion, but it's not worth it.
It's so sensitive.
Any person with a sensitive skin, if they try this, they are 100% going to get a breakout or a rash for sure. And the results are not long lasting. I mean, again, this is that quick fix that people want. They feel like, okay, we'll apply this, our sagging will go away. That's a myth. It doesn't help.
No, I'm staying far away from them. I don't want any rash. So how do you build collagen under the skin? What's the right way to do it?
So see, to some extent, taking supplements help. You take it orally, IV, sachets, in whatever form, but they will probably just help in delaying the aging process. They'll not help in building what is already lost. So if you're facing a sagging skin issue or acne scars, all these are because of collagen depletion, then you'll have to physically do collagen building treatments. And the most common one that we do nowadays is all your micro needling. It could be a derma roller, it could be derma pen, MNRF, it could be PRP, GFC, even CO2 lasers, fractional lasers. These are the ways that you can actually build collagen in your skin.
So I see a lot of clients coming in for these, and I also feel it's seasonal. Things with downtime goes down during wedding season. Now pre-summer, like we're not so close to summer.
That's why the customization that we do.
Yeah, absolutely. So depending on what people are getting ready for, we can tailor what we're using.
100%. And again, collagen building is not a one-time treatment. You have to keep doing it monthly. It takes around 3 weeks for the collagen to build. So if you do any micro needling in one session, you might not even see a difference. So that's how we always say that keep doing, invest in your skin.
Absolutely. So what is HIFU and how does that help?
So HIFU is, the full form is your high intensity focused ultrasound. It's actually a non-invasive facelift that we call it nowadays. It I've seen a lot of people who come in and first thing, without even getting into a consult, they go like, okay, doc, I don't want any needles. I don't want Botox, fillers, threads. Fair point. I mean, it should not be a first line of management. So HIFU helps with little bit of skin lift and tightening without almost zero downtime, minimal downtime. No needles, no prick, no injection. It's a procedure that is done by qualified doctors that I also do. We all do it here. It sends in heat energy and it creates these thermal areas under your skin, helping at your collagen layer and your deeper layer, and gives you a good results. And it takes around 3 to 4 weeks. It keeps getting better with every week that you do the treatment.
And is it usually, do we do it one time or multiple times?
So ideally, very natural. If you want to look, I think once a year is fine. But of course, some people do want a touch up, so you can do it once in 3 to 6 months. But more than that, I'll not recommend.
Great. So these are all questions that come into us regularly.
Yeah.
I think the most buzzing one is, like you said, IV and skin lightening.
Yeah.
Speaking about skin lightening and color pigmentation solutions, Indian skin is known to pigment easily.
Yes,
so what do we
100%.
offer for it and what actually works?
I'm going to ask you this question again because
Yes.
again we've both gone through it personally, so we know. So stubborn pigmentation is something that it's there since a while and probably it's gone in deeper layers of your skin, and anything that is there since a while, again, there's no quick fix. So we always, if the actual disease which has caused this is cured, then we focused on topical application. There are multiple skin whitening agents. I would not say that okay, only glycolic will help you, only kojic will help you, because every skin is again different, every pigmentation is different, which people don't realize. Then we have your laser treatment options available, especially at Elixir. We have Q-switch laser, which works at a deeper layer. Medifacials are to some extent a quick fix. If you're suffering from pigmentation, you can come here, do a medifacial and get that hydration, rejuvenated look. We have chemical peels available, and of course, last resort is always our injectables.
Absolutely.
That's in place.
What is your favorite of Elixir services?
I'll say the lemon tea to begin with. First day that I came and met you, I had that lemon tea and I was like, oh my god, if the tea is so good, I'm just excited of what's in store. But I mean, Elixir is something that I feel it's our brain and sweat put together. So it's not nice to even, I don't think I'll do justice by picking up any one service. But I think I would still choose HIFU because I am happy definitely, but I feel our clients or our patients are very, very happy with the treatment, and that's the most popular treatment I feel in our clinic.
And I feel month on month the number of
it's increasing. And you'll be surprised. There are people who are even messaging you that, okay, Tanya, like I heard, can I do this HIFU and can I come in?
Absolutely.
And you're like, listen, can you, this is a friend of mine, she's heard about it, and HIFU, I think it's spreading also.
Absolutely.
Very fast.
HIFU and I think Botox is also spreading.
No injectables. Clearly, people are against it. I mean, I think we should talk on injectables someday.
Absolutely.
About the notion that okay, if you inject something, you look weird. That is false.
Let's talk about that quickly. Yes. Botox, fillers, threads, these are some of the injectables that we use, and there's enough videos and content about how it looks when it goes wrong. But there are many ways to do it right. So let's talk a little bit about that.
So see, these three are beautiful procedures. I mean, before I became a doctor, even I used to feel that okay, what is this? Why are people looking like this? But now when I'm doing it and when I'm doing it on patients, I have been trained myself, I've realized the key is to always underdo it. There are a lot of people who actually suffer from an anatomical structural defect where these things really are a game changer. It's when you've crossed a line, when you've overdone it, and when you feel like, there are sometimes patients who tell doctors, okay, no, I feel you've done it less, can you do it more? You should trust your doctor and you should stick to as much as minimal things as possible to get a very natural and fabulous result. So it's please drop in to understand about it more, because it's a myth. We can also show before after photos. And it is a myth. It's not that every face gets distorted if you do any injectable.
And it's not that every place will push injectables if you're not someone who wants it either.
And not every place has Tanya who's like, okay, you are the doctor, please. I think they should cut this part. But even here, I would like to ask you that you have also struggled a lot, with hormonal issues, acne, pigmentation. What would you like to tell our audience when it comes to a quick fix?
So honestly, I don't think there is a quick fix, unfortunately.
Exactly.
It doesn't exist.
Yeah.
I've had severe PCOS. I talk about it a lot actually on my page and stuff in terms of my story. My team also knows about it. I'm still struggling on a daily basis with medications and side effects. Just doesn't end. Everything has some other effect that cascades. There is no quick fix. There are days when I'm here dealing with nausea. There are days when it's like, oh my god, this has popped up on my skin. What do I do? So that's sort of a constant journey, but there's no quick fix. It's about understanding your body, understanding the cause behind it. So if it is a hormonal issue, how do you address it? How do you look at it long term? And then working on steps and lifestyle changes that work for you. And I'm someone who's very regimented with my routine when it comes to my skin. So with my IV facials, I don't end up getting the time to do as much as I'd like to. Facials and hyperbaric, I want to make a more regular part of my life. But my skincare routine, my IV therapy, right now I think once in 3 months at least I'm getting time to do a facial. And so I'm very regimented with my routine and my medicines and everything that I have to do.
Only one thing I'll add here is when Tanya's talking about routine, she doesn't just mean your AM, PM routine. It's actually a routine of your mental health, your diet, your exercise, your physical fitness, and then last is your AM, PM routine.
Absolutely. I do my work in terms of mental health, in terms of physio, workout, depending on how my physical state is, that's regular or not. Nutrition, we're working with a nutritionist as well. So it's a holistic approach.
One-stop solution for everything yours.
Absolutely. Yes, and we have everything in-house at Elixir.
We have everything, I feel,
But I feel because of our journeys also we've been able to add that, because we've sort of been able to identify what's missing and add those pieces.
This is customization where, patients have come in, okay, we have back issue, we have this, that's how we've gotten physio, we've gotten an orthopedic, that's how we are.
That's actually how the whole Elixir has grown. It started with IV and then now skin, now hair, now weight. So. Weight loss, actually, since we're pre-summer, I noticed while looking at our numbers this month that it's been our most popular therapy at the clinic. The number of weight loss sessions we've done has been higher than anything else this month. So what exactly are we doing for weight loss, and how do the machines work?
So first thing is that even weight loss, I've seen people walk in and they're like, okay, we want to lose this much, and how much time will I take? And it starts with, I make them meet our nutritionist so that they understand that, okay, first, I always, if you've seen my prescription, I write point 1, diet and exercise, because there is no quick fix and no compensation for that. So we always start with that. We have a machine where we check their BMI, we check their fat percentage, muscle percentage, protein, water intake, everything. So we start with the underlying cause. We have metabolism booster drips available. We have various machines, and in a very healthy way, we inculcate that in their treatment so that we don't want it to be dependent. It's not like once you stop doing it, you should get a rebound, and every body type is different. So if something's worked for someone, we don't just follow the same protocol. We understand every body type and we help with our machines, our drips, our treatment, everything together.
That's literally how the care is customized. So we're still answering that question.
But we have in terms of machines, we have various machines. We have machine that works on your fat layer, like our fat cavitation, our deep heat, our cryo melt. We have machine which helps with your muscle strength also. We have Tesla, we have EMS available for that. So I feel we are covered. Like I don't think
even just for metabolism, like with the sauna and the cryo and IV, you have metabolism
in
covered
fact,
as
even
well.
our cryo therapy, our full body cryo, really there are people who love it. They walk in
Yeah.
just to get that it helps with your metabolism boosting as well. Not just your
Absolutely.
physical recovery, but also boosting
And I
your
think
metabolism.
it keeps your metabolism going. Like if
Yeah,
you've done a 3-minute
yeah.
session of cryo, you're burning 1200
Yeah.
calories additional
And
that
you
day.
know, one thing is, I remember two of my friends were like, okay, 3 minutes is very less. And
Yeah.
when they've come and they've done it, that 3 minutes
It's
is a long time. We both know one has chumped out and one has barely survived. So 3 minutes is a long time.
Yeah, you really feel time.
Yeah, it's minus 183 degrees. It's a long time.
My last question, Dr.
Yeah.
Sakshi, is another treatment that we're seeing coming up more and more often, and that's hair PRP.
Hair PRP. So again, hair PRP is PRP something that we do for various things. It started with hair, but we do it for pigmentation, collagen building, stretch marks, everything. So when it comes to hair, people first need to start to differentiate hair fall versus hair loss because of thinning. In either case, PRP works very well, but please, it's an add-on treatment. You have to again start with baseline, treat the underlying cause, focus on your roots, focus on if there's genetic tendency of miniaturization or thinning of hair, then that's another ball game altogether. We have to focus with tablets, supplements, serums. Then with hair PRP, it's basically your blood that we withdraw, we centrifuge, and we only inject the growth factors back into your scalp. So if done correctly, on correct time, with proper intervals, it has shown amazing results for hair growth.
And it's something that we're seeing clients recommending friends and coming back for more and more.
100%. Because there is, I mean, it's your blood growth factors going back into your scalp, you know. So it's actually an non-invasive treatment, though it involves injection. It's nothing major. It's become a very casual procedure now.
Especially after PRP on the face is also the famous vampire facial.
Yes, exactly. Yeah. Vampire facial is nothing but PRP on your face. Yeah, so it helps in the similar way how it's helping your root stimulation and hair growth. On your face, it's helping you with collagen building. I've seen amazing results with pigmentation as well. Okay. So similar, the underlying logic is similar. It's helping with your collagen building. Okay.
So as you can see, we have lots available and a really holistic space at Elixir. We'd love to see you in, and thank you for joining us for this fun episode. We'll be back again soon.